Dementia Researcher with a blog and a rating.
How I got into clinical research, my career journey. Hello, my name is Julie Scott. I work as a research nurse for the Neuroprogressive and Dementia Network as part of the Grampian branch working in Aberdeen. My career has taken me through many types of caring pathways. I have been a nanny, a care assistant in a retirement home for the blind. I worked in a day centre for children with physical and mental health challenges, and in a purpose-built adult support living unit. My first experiences of a dementia ward was a 28-bedded male unit in a long-term stay hospital as a nursing auxiliary, and it was here I wanted to understand the illness and its complexities more, and I applied for nurse training. I first became an enrolled nurse, and then with further training became a registered mental health nurse. In amongst all of this, I became a mum and raised 2 boys. Before coming into research, I worked on a dementia assessment unit in a community hospital setting where we as a team saw the ward change from a 30-bedded long stay unit to an assessment-only unit. We lost many beds along the way. Before I left in 2018, we had moved to a purpose-built facility and had just 10 beds available for assessment of patients who were quite distressed or needing changes to the medication, which meant a short stay in hospital to facilitate this. We occasionally did respite care for patients whose carers were in desperate need of support or a break. Prior to this, I worked in a large mental health teaching hospital for adult and older adult patients. I started in research at the age of 55 when a vacancy was highlighted to me by a colleague. I found out about the job and what it entailed, who the Neuroprogressive and Dementia Network were, and I decided to go ahead and apply. At the time the job was advertised, the NDN Aberdeen were hosting a conference at King's College Aberdeen. I found out about it and secured a ticket. It was the first time I had been to a research conference, and while there I met the Aberdeen team. I found the conference very interesting, and it helped me think differently about the PowerPoint presentation I needed to do for the upcoming interview. Once successfully through the interview and waiting for a start date, on my days off I attended some training days put on for new researchers by Grampian R&D department. I attended things like lab skills, good clinical practice, and informed consent, among other things. I was beginning to wonder if I could process all this information. I had gone from individual care planning and assessing patients, doing work rotas and co-managing staff covering a busy ward, to learning about processing blood in labs and all the ethics and good clinical practice. I became aware in the early stages that, as with ward nursing, research nursing puts the patient at the centre of all decisions made. Once started in my new role, I was to work on the EPAD study, the European Prevention of Alzheimer's Dementia. There was a lot of training to do. Apart from the everyday research skills, there was trial-specific training and procedures, and as with all learning, it needs to be backed up with practice. The team were very supportive, ensuring I got lots of opportunities to observe, and then, as my confidence grew, to do assessments for myself. Learning as a mature person is very different, and although dedicated, I found it challenging. Along with my children leaving home and going on to university, I did feel overwhelmed by all the learning and questioned my ability, hoping I had done the right thing. 6.5 years later, I am doing study-related training still, as well as coordinating some of the trials at site. My computer skills have improved tenfold, and still more to learn in this area. We, the staff, have reduced in numbers because of cutbacks, and I am the only member of the original team from when I started in 2018. We are a small and productive team. We are very supportive of each other. During my time with the network, we as a team have moved from predominantly dementia studies to other neuroprogressive diseases, including motor neurons disease, Huntington's disease, Parkinson's disease, multiple sclerosis, as well as introducing research to nursing homes. We take opportunities as they come along to challenge ourselves, such as taking on infusion studies, which, coming from a mental health background, is definitely a new area for me. But we feel the fear and do it anyway, supported by the wider team. While I miss the day-to-day patient contact and helping on a very personal level, not just with the patients but their families as well, I do not regret the change. I am in awe of the volunteers on our trials who find the strength and time to participate when faced with life-limiting conditions. The support we can provide to participants that they might not get from their normal care provider through the findings of our investigations have helped a few patients by highlighting undetected health issues, resulting in referrals made to other specialities for further scrutiny. I'm looking forward to new research coming our way in the future. Thank you for listening.
Thank you for listening. Join the Dementia Research bloggers and share your own views.